When they invited me to speak at the Wayne State University Mayor's Health Equity Summit, and I understood that they really were committed to establishing health equity as a partnership between the university, the city, the communities, and other organizations. I came here today to explain what other communities were doing, what's an approach to health equity. It's not as easy as just sitting down around a table and saying, okay, we're going to do an intervention. It's actually a very long process that means that you need to really engage the people that you want to work with as partners. The people who are most affected by the problems you're trying to solve should be at the table as well. And I just wanted to bring that perspective here today. Well, today, during the presentation, I had the opportunity to show two maps. The first map is one that will be released later this month, and it shows life expectancy in Detroit based on where you live in different places around the city. And the real point of that map was to say that that where you live makes a difference to your health, that your zip code matters as much as anything else in determining how healthy that you might be, and in this case, how long you might live. The second map I showed was a map from the 1930s. It was a map that investors had put together about where to position their investments into communities, and so that communities could thrive. And the communities, though, that were excluded were redlined. And so on that map from the 1930s, you saw red areas of Detroit where the investors and others had agreed that they were not going to put investments there. They're not going to put services there. Nearly 100 years later, we call them underserved communities. Well, the plan to underservice them was established a long time ago and has had devastating effects on the health of communities. And I just wanted to overlay those two maps together so that we could drill the point through that policies and practices and procedures, what we typically call systems, have been in place that have made places in Detroit less healthier than others. And since we know that, then we can also do our best to address those systems so that they work better and they work better for people in their immediate lives. To do this work, if you really want to achieve health equity, you can't assume that everyone knows what everyone else knows who's sitting around the table, and you can't assume that the solutions are going to just bubble up from conversation, discussion, conferences, and reports. There are communities around the country that are also facing this challenge. Communities that some of which have gone further than Detroit have, some of them have not started where Detroit has. And I think the communities can learn from one another. In November or December of this year, the National Academies of Medicine is putting out a report called Community-Based Solutions for Achieving Health Equity. The commissioners who are writing this report are traveling around the country, looking at those areas that have started on this journey, trying to understand what were the barriers that they were trying to get past and what solutions did they come up with. Our expectations is that this book could be a guide, but not a set of regulations. What I mean by that is the things that'll be in this commission's report will be helpful to some thoughts you may have for your own community, but every community is unique, every community is distinctive from one another, and so what works in one place might need to be tweaked to work in Detroit, you know, if you really want to help these communities. But the Robert Wood Johnson Foundation is supporting this report because we know that now is the time that people are focused on change, people are focused on health equity, and we're hopeful that this report will just help accelerate them along their journey. Communities need to insist on being engaged as authentic partners, position community leaders, whether they are elected or whether they are informal leaders, to engage with other sectors of their local society. So to engage with business, not against business, with business, to engage with the universities, to engage with those types of anchor institutions, and for everyone to come together and say, we need to do something together, let's start figuring out what to do. However, during my comments today, I said one of the first steps you do once you get people together is you come up with a set of principles for equity, a set of principles that you can use as your touchstone, so that when things get tough, then you can say, listen, this is what we're here for. And where things are great, say, listen, this is what we should celebrate. Our celebration should be based on our principles. The things that get us through our tough times should be based on those principles as well. And that's a good first step to people coming together, because it's really about building relationships and then looking at the assets that are in communities, just like the researchers at universities will have assets, the bankers have assets, our communities have assets, and those assets usually do not get highlighted as much as the deficits. Bring the assets to the table and then come together as peers and partners. Trust is very important to this process. there is, when you start talking about issues of health equity, then you have to really delve into the inequities that may have been based on race or racism, inequities that may be based on gender or sexual orientation or income level. And that will lead you into some tough discussions. It won't be your typical business meeting where folks are there and they speak the same language and they're ready to move on and meet their objectives. These are conversations that need to happen. And everyone needs to commit to staying at the table. If the trust isn't already there, then this process will help build trust. If the trust isn't already there, then people need to admit, we're not quite there yet, okay? And that's a tough thing to hear. When you take it personally. But when you understand that your goal is bigger than any individual's ego, that your goals are really to do what our framers of the Constitution said, we are supposed to create a more perfect union so that we all have the opportunity for life, liberty, and a pursuit of happiness. When you understand that the work that you're doing is so much bigger than any individual, any sector that's sitting at the table, that it's about the collective, then you can build trust, and trust will come. But if trust isn't there, you have to admit that from the beginning, and then work on it and see what comes from that. And everything will be better. Right, and it's hard to look somebody in the eye and say that your institution has negatively affected the life chances of my family, of my people, and my community. And it's hard to hear that too, you know? And so, but that's the kind of conversation that needs to happen to establish trust, and just to go ahead and say it, okay? I've got people in my family who are locked up, okay? I need to be able to admit that wherever I go. I need to be able to say that even as I sit at the table with others, trying to make the world a better place and all those wonderful things. I need to tell them, yeah, no, I came from a poor family, okay? And being able to tell our story and be authentic about our story and have that story heard, not the easiest thing to do, but then after I tell my story, I need to hear your story. I need to understand how you come at this. I need to understand your perspective. And now we're getting to a point of understanding. And a point of understanding is that first step towards trust. You're not going to get the trust immediately from there, but at least you'll know each other a little bit better. At least you'll know about the things that you're concerned with. And that's why having some principles for equity, really, really important. But it takes talking and being brave and being authentic and being genuine. And most people don't have a problem with that, but it also takes listening. And listening with the same type of ears that you want somebody to hear your story.